buddy here, Stephan. He seems to have fucked with the wrong person, and now he's bleeding out. And so I will leave it to you guys to knock that out.
Well, he'll be okay for a minute.
Yeah, for a minute.
All right. Hey, so standard tourniquet application. If you have one of these prefabricated, manufactured pieces of work here, you have your pretty thick strap here that's going to go above the wound site. Yeah, you got a wound right here. I like, as a rule of thumb, to go 2 to 3 inches above, but it's never a bad idea just to go above the joint right here. Just get it high and tight. If you have time to cut the clothes off, make it a little bit easier. If not, you may just have to throw it right over the top. I always have to have these prepped, just ready to go. You pull this out of your bag, and it's still in the plastic. You have to peel all that stuff off in a time of need. You're probably a little behind the power curve already, okay? So yeah, I know when I carry these on kit, or I have them ready, or when I issue them out to folks, I always teach them to have them in such a way that they're ready to go when they pull them out. So let's say Jimmy has some kind of an uncontrolled hemorrhage here in his lower arm. I'm going to take a look here. Be careful not to grossly manipulate anything down here that may be fractured. Now with the tourniquet, the windlass here, turning this and tightening it is pretty important. But I'm going to tell you that getting this strap properly in place and getting it as tight as possible with the friction adapter or the other mechanical processes that are here is just as important. So once you have that in there as tight as you can, that's when you're going to start to crank on this little fella right here, the little windlass. And whatever caused this hemorrhage or this injury, likely going to be painful. So everyone's like, wow, when you put these tourniquets on, they really hurt. Well, yeah, that's but the point of being that this is probably going to be a little more painful than what I'm doing with the tourniquet, all right? So I always like to keep a look at my patient. Hey, Jimmy, how you doing, man? Does that hurt? Yeah. Okay, you're doing all right? Okay, I'm going to crank this. And when he says, okay, that kind of hurts, I may give it 1/2 or more of a turn just to be sure that it's on there tight enough. Now, these manufactured tourniquets have these fancy little attachments here where you can actually secure the windlass in place. What I like to do here is just visualize this. Take a look. Is the blood still flowing? Kind of wipe it out of the way with gloves, of course. Or if you trust Jimmy, yeah, okay, I'll just wipe this off. Great. Now, what I'm going to do at this point is I'm going to feel for a pulse. And I do not have a pulse on Jimmy right now. I do not have a radial pulse, which is telling me that tourniquet is doing what it's supposed to be doing. And what I would do at that point is make sure it's nice and secure, clean everything up, cover it up for sanitary purposes. And I would note either on a patient treatment card, or I just go ahead and write right here on his arm, yeah, it's about 20 after 5. So I put 5:20 TK tourniquet. And then that way, any kind of a EMS personnel that come out is going to know that, hey, this tourniquet was put on about 20 minutes ago. So from there, I'll give you a little bit of relief there. And so again, these tourniquets here are really well manufactured. There's a half a dozen really good different names out there. I won't really get into those right now.
If you're enjoying this video, I want to take a second to talk about EliteU.com, where you'll be able to find early access to all of our YouTube content, as well as exclusive interviews and access to mentors. And now back to the video.
But let's just say you don't have anything like this, right? So before these were all commercially available, the thing was just to manufacture your own. Everybody has some kind of a scarf or a t-shirt or some kind of a large piece of fabric. So we'll use these improvised ones on our friend here that's had a little bit of bleeding. So I want to start out with a bandage type thing to kind of take a look at where the blood is pooling. And I'm going to go 2 to 3 inches above if I have to, or I would just find that the anatomical landmark being the joint above. So lower leg, I go above the knee. If it was on somewhere on the femur here, or on the upper leg, I would go as high and tight as I could into here. But for these purposes, I'm going to go just above our little fella's elbow right here. I will put this on here, tie it with a double knot, make sure it's nice and tight. Insert our kind of like an improvised windlass. I have a piece of PVC here. You could use a wooden dowel. There was one video that I did earlier where I just grab the MDV and use it as a windlass. I wouldn't recommend using a knife as a part of a tourniquet, but if that's all you have, that's all you have. So put this in here. I'm gonna crank this down until this, either I have relief of the blood, I see it stop bleeding, there's nothing else here, or I lose that pulse. Whether it's the radial or up higher, I can use a brachial pulse. Once I have that secured there, I'm gonna take some other piece of fabric, another t-shirt, another scarf, or something like that, and I am gonna simply tie this in place to stop it from slipping. Again, anytime I do any kind of a movement or any kind of a modification to the treatment, I'm always gonna go back and check my treatment. So I'm gonna make sure there's no blood here. He still doesn't have a pulse. Yeah, it's gonna be uncomfortable. It's probably gonna be painful, but anesthesiologists, surgeons, they regularly have tourniquets in place during like an operating room scenario for hours and hours and hours at a time without any tissue damage, anything that's a detriment to the patient. So from there, I'll hand them off to the next medical person, whether it's an EMS that's going to take him to the hospital or a doctor or something like that. Just remember to keep everything as clean as you can, cover up the wound, cover up the wound area.